How do you get onto the Mary Pack program or the Oasis program?
Oh, how do you get on the
Why-
Mary Pack program
yeah.
at the Oasis? You need a referral from your family doctor, and the referral forms are online through Vancouver Coastal Health for both of them.
Yeah, my own doctor doesn't like to refer anything.
I think, the Oasis program referral, I think it's money our tax dollars well spent, because it gives people a program. It's individualized. It's only 1 or 2 sessions, so I think it's money well spent.
I'm going to ask a question, actually, it's on behalf of my husband, but an X-ray has shown that he does have arthritis in his knee, and he's going to see a specialist. I know that some specialists may suggest or recommend like a cortisone shot or a gel kind of something. Can you say a little bit about that and the benefits of that?
So the question was, a husband with osteoarthritis of the knee and possibly maybe referred for a cortisone shot or the gel shot, right? And you don't know what they're going to suggest. Yes. The evidence, okay, long story short, the cortisone shots can be temporarily beneficial if the knee is suddenly worsened. So a flare-up, say you have osteoarthritis of the knee, something happened and suddenly your pain's gone from a 2 out of 10 to a 6 out of 10. It's red, it's swollen, it's painful, you can't put weight on it. That time of the cortisone shot, I would drain the knee, send it for testing, see what's going on, and I would inject it, and that'll bring that down back to a 2 out of 10. And it may last for a long time. It may last until the next time it flares. So cortisone shots are fine in that case. If your knee's always a 2 out of 10, a steroid cortisone shot is not going to be good long term, and in fact, I think I would avoid it. Okay, the gel stuff, the visco supplementation it's very expensive. We were part of a systematic review of them. I'm not that excited about them. I think they're very expensive. I have some patients that keep coming every 6 months and get them. They're safe, but I think the evidence is equivocal on those shots. So I don't push patients to go for it. If they come in and they say, "Oh, I'd like to have these," I'm like, "Sure, I'll stick it in your knee, no problem." But I'm not that excited about it. And neither of those take the place of lifestyle changes.
Or if it really gets worse, then a replacement.
Yes. So she said, so lifestyle changes, yes. If it suddenly gets worse, you could get it drained and a shot, and there's no problem with that, really. And I'm just not really there for that visco supplementation, the gel stuff.
So just before the next question, just following up on the lifestyle changes, we've talked about exercise. What about food?
So, I'm really, after all these years, I'm wondering what's the best. Seeing my patients trying to change their diet, really it's hard to change the way we eat. We grew up eating a certain way, our ethnicities and our parents and everything, we grew up eating a certain way, and it's super hard to change that. But we can change some habits. And I think especially, and if you're a little overweight, then there's some habits we can change and some things that we could probably avoid very nicely, including sugary drinks, which are terrible, high fructose corn syrup, lots of calories, eating, and habits like eating after dinner, those sort of things. But really, if you approach food in terms of my patients, if it's the other type of arthritis, the inflammation types of arthritis, it's shown that a plant-based diet is probably helpful. High fish oils, helpful. And then I'm quoting some evidence from studies. High fish oils in the diet. So salmon, try to avoid long living fish like tuna because it has more mercury. So salmon and sardines and those fish are probably helpful. Again, like I said, it's hard to change our diet, and if you're a meat and potatoes person, you're not going to become a vegetarian, though a vegetarian diet is probably beneficial for inflammation, but you may be able to go a couple of days a week of no meat, right? So I think just being practical, I just hate to make my patients feel guilty if they're not having wholesale changes to their diet.
Question in the second row.
I've, sorry, I've had X-rays of my hands, and the bones in the fingers showed lacy reticulation, and they believe it may be sarcoid. Could you tell me where I could get assistance for dealing with that, please?
So lacy reticulations could be sarcoid, absolutely possible. Sarcoid is a rare condition that's typically not dangerous. It can affect organs. One of them is the bones. I think you should see one of us, basically.
So how would I get
Just,
to see
where
you?
do you live?
I live in Richmond.
There's some excellent rheumatologists in Richmond. Your family doctor will know who they are. Karani, Megan Hiltz, James Young. They will, and there's a BC Society of Rheumatology website, and you could see which rheumatologist is close to you.
So have some of them actually sort of gone directly or studied sarcoidosis so that they're more familiar with it?
They will all be familiar with
They
it. We
will.
see it all the time.
Oh, you do?
It's rare, but it
'Cause I
always,
thought if
it
it's rare
frequently
that-
comes to
oh,
us.
I see.
Yes.
Okay.
Yeah.
All right. And you have to take medication, I'm assuming, for that?
Not necessarily.
Oh, fantastic.
So I think with sarcoid, it's a rare condition, but we look for it elsewhere. We see the extent. It's totally manageable.
The pain also then?
Yes, but I suspect you have some osteoarthritis too.
Okay. All right. Thank you.
Please. We'll take one more question, then I'm going to have a couple of questions for Dr. Shojania about what's developing in terms of research and also what's changing the way of education of physicians, to give you a heads up on that. And then I'll also let you know that Dr. Shojania, even though he's on call, has agreed he'll come over to the CRSIL booth and spend a few minutes before he has to get back to duty at our booth, which is by the entrance. So please go ahead.
Okay, so I kind of have a couple of questions. So what you're really saying is the biggest ingredients that we're putting in on a day-to-day basis, we really have to be cognizant of those. So if we're consuming a lot of meats, dairy sugars, sweets, meat, lots of like high inflammation causing meats, coffees, dark teas, these are things that are going to cause a lot of acidity and inflammation in the body.
I'm not sure. You know, here's the weird thing. I think, look, if you look at the blue zones on the Earth and you see what do people do in those zones to be healthy.
Do you want to, just quickly tell people what the blue zones are? I know it's a dietary thing and where people are studied and live longer and that kind of stuff.
So blue zones are like, I think, you know, some places in Japan, Okinawa, I think, and there's a couple of places off Italy where it's hilly. I think, is Richmond a blue zone in Richmond, BC? But they live a long time, FYI, Richmond. But there's a place on Earth where people live a long time and they're very healthy. And people look at what do these people do? And it looks like they have different diets in different parts of the world. They're not too fussy about what they eat, but they don't eat fast foods for the most part. They eat, I think, the same way they've been eating for hundreds of years. They walk a lot. They eat together in groups. They spend a long time at lunch. They don't eat at their desks. So I'm not sure if we have to focus on specific foods or not. I think we just have to, like my in-laws have lived a long time, and they have no business living that long because they have lots of medical issues, but they're Greek and they have a Mediterranean diet. So we're always eating dandelion greens and Greek salad and fish and beans and stuff. So I think I don't know about acidity of foods, and I don't know, other people know more about that than I do, but I think avoiding fast foods, we didn't talk about smoking, but not smoking. I think coffee, I don't know. Tea, I don't know. The evidence is up and down with those, but I think so. The answer is I don't know the answer to your question.
Well, that's okay. No, that's good. Now, but you did emphasize a plant-based diet. So
Absolutely.
So really eating foods that are, because I know meats can really tax they take a lot of energy for the organs, the stomach to process. So obviously a plant-based diet is going to be a lot easier on the digestive system. Okay, and that makes a lot of sense. So one, everyone's mentioning a lot of different products. One product that I wanted to ask about was one called Lakota. I'm not sure if you're familiar with the product.
I remember that from the 90s. I don't know much about it though.
Okay.
But I don't know about I don't know.
Yeah. No,
And but
It's
yeah.
a herbal product,
it is a herbal product
sold
used
through
typically for.
Costco and so forth.
Yeah,
I would invite you to
arthritis.
ask the makers to what the clinical research shows on it, and maybe leave it at that. So
Okay, fair enough. And then sort of the final little
yeah.
question is, a lot of people are very big on fasting. You know, like eat 6 days a week, take 1 day off, give your stomach a rest, give your body a rest, give everything, all your organs a chance to rest, and you know it's supposed to be healthy for the body. I just wanted to get your sort of thought on that.
Many years ago, when people with rheumatoid, we had no treatments for rheumatoid. People were basically dying and from the disease. They would fast them, and fasting is an immune suppressant. So when people starve, how do they die? And it's a terrible question to ask. When people are in places where they don't have enough food, how do they die? You ever wonder that? They die of infection because their immune systems are low. So one way that was managing rheumatoid arthritis many, many years ago was to fast people. Their immune system would be depressed a bit and they would stop attacking their joints. I don't recommend that now. We have lots of better ways of treating. I don't know about the virtues of fasting in general for health. I know my dad used to do that. That's a good question. I don't know the answer to that one.
well, before we go to the last couple of questions, let me just do a quick ad for Sierra Sil with apologies to you, but I've got a colleague here who probably wouldn't be happy if I didn't mention. At Sierra Sil, our goal is very simple. We want to help people be healthier, more active, and we think we have a great tool to do that, and that is with our primary product, which is Sierra Sil Joint Formula 14. As Dr. Shojania mentioned, we have research behind it. Most people get results within a few days. Our promise is within 2 weeks or your money back. And we really want people, if they didn't get results, to be in touch so we can give them their money back. We want people to have a good experience. And we're local, we're based in Vancouver, and happy to answer your questions at our booth, which is by the door. But our goal is just to help you be healthier and more active. And so that's what we'd like to do. And if we can help you on that journey, that would be awesome. So I've got a couple more questions for you. One of which is, what's new in arthritis research?
We're lucky in Vancouver. We have a place called Arthritis Research Canada, which is based in Richmond, connected with UBC and other institutions. 15 scientists, amazing peer-reviewed research being done there, including research that we've all contributed data to. So they're using Population Data BC, where all of our health information, anonymized, is being put through, and we could look at trends. For example, medications being exposed in mums, and looking at the health of the kids. And we have data for many years on that in everyone in BC. So what Linda Lee there is doing research on wearables and improving people's fitness using wearables. There are Deanne Lakai is doing work on keeping people with rheumatoid arthritis at work longer, preventing disability. Antonio Avinia is doing amazing work on vasculitis, which is a rare type of autoimmune disease, and connective tissue diseases like lupus. So we're lucky here in BC. Many advances are being made, and what's new for rheumatoid arthritis is that for rheumatoid arthritis, if we catch it early and hit it hard, we can put it into remission in many cases.
Before I get to my last question, do you know the website for that if people want to look it up?
www.arthritisresearch.ca.
And I'll just add too that Dr. Shojania is not accepting any remuneration for being here, but we will be making a donation to that organization on his behalf as a thank you for him taking time out of his day to be with us today. So we thank you for that. What about the Mary Pack Arthritis program? Do you know the website offhand for that? Or people look at Mary Pack, P-A-C-K.
Yeah.
Arthritis. You can look it up. It's part of Vancouver Coastal Health.
Yeah.
And you can look it up that way. Sierra Sil, yeah, you can come to our booth and find that out. So my last question for you is around medical education. And we're just curious, what's changing in terms of medical education for rheumatologists and so forth, because you are head of rheumatology at UBC.
You know, like I said, I trained more than 20 years ago, and when I was training, we actually were trained in the science, we were trained in managing patients, but we weren't really trained in lifestyle or other aspects or the softer skills, which is why a lot of the doctors of my generation and older, sometimes bedside manners aren't as good and they don't know a lot about those other areas. But the new generation of doctors, I have to say, they are great. They're being trained in all these other aspects. I think that for example, we take our residents every Friday for a workout. Friday at 4, we make them exercise. They initially didn't like it at the beginning, but then they get really addicted to it, and we talk about what exercises are good for what kinds of conditions. So the new generation of doctors is different. I think our health is in good hands in the next generation.
Thank you. And so if you have some more questions for Dr. Shojania, our booth is just by the door that you came in, near the front of the hall. And we can't thank you enough. So if we could give Dr. Shojania a warm health show applause and thank you.
Thank you.
And so, yeah, thank you so much. We're deeply honored, and again, thank you. And thank you, folks, for coming and engaging and coming to learn.